Bulging disc symptoms. You had an MRI of your lower back and the MRI report says that you have a bulging disc or a disc bulge, or more specifically, an L4, L5 disc bulge or an L5S1 disc bulge. In this video, I'm going to describe and explain to you what a bulging disc symptom is and what the symptoms are of bulging discs. I've been a chiropractor now for 20 years, and thousands of people have walked in through our doors that we have helped. We have helped people with symptoms related to disc bulges, disc herniations, sciatica, postural problems, scoliosis, and other conditions related to the spine with our corrective chiropractic method. Hi there, I'm Dr. Walter Slubro, the chiropractor here at Back to Health Chiropractic Center in Vaughan, Ontario, Canada. The place where chronic pain sufferers come for corrective chiropractic methods that help alleviate pain related to spinal conditions, help improve alignment of the spine, improve posture, improve mobility, reduce the discomfort, and overall improve the quality of life and quality of health without using drugs or surgery. And in this video, I'm not only going to show you bulging disc symptoms and explain to you what bulging disc symptoms are, but I'm also going to show you and explain to you the anatomy behind the bulging disc and how the anatomy of a bulging disc triggers bulging disc symptoms when there's injury there. And when you get this, you'll see why it's important to look for treatment that focuses on correcting the underlying spinal problem, the underlying cause of that disc damage, so you can start to reduce the strains and injuries on the discs and surrounding tissues. And this is the key. This is the true key to resolving and creating more permanent solutions and a more permanent alleviation of pain that's related to symptoms associated with bulging discs. If you've been diagnosed with a bulging disc or had an MRI that stated you had a bulging disc in your lower back, I want to hear from you. Let me know what type of therapies or treatments you've done. Let me know what's worked for you. Have you gone more of the conservative route, like chiropractic or physiotherapy, or have you gone more of the mainstream medical route, like drugs or surgery? Let me know in the comments below what's worked for you and what hasn't of those two options. Before I get into the anatomy of a bulging disc and the symptoms associated with a bulging disc, let me share with you an actual case study of a patient of mine who came in with symptoms associated with L4, L5 disc bulge and L5S1 disc bulge. And with the corrective methods that we applied and helped him with, he was able to regain his mobility, decrease all that pain in his back and his legs, and also restore his overall quality of life. This man, when he presented to my office, he had back pain that was associated with L4, L5 disc bulge and L5S1 disc bulge. The pain was so severe that he can barely walk in our office. He can barely get down into the rooms without having to hold on to a wall or some kind of countertop. That's how severe it was. In most cases, he was really stooped forward and supporting himself as he was trying to walk. So we assessed him and started the corrective process, and we started to apply our corrective chiropractic methods, which involved spinal adjustments to the spine, also involved postural exercises, postural corrective adjustments, and as well as traction procedures. And we did this over a span of 12 weeks. And on his reevaluation visit, these were his results. His pain alleviated by 80%. He was able to walk normally again. He was not stooped forward in that antalgic pain posture. He had better mobility, no leg pain, and was able to get back to his regular activities of daily living. He enjoyed leisure walkings again and was able to get back to work and do his activities at work as well. That is the benefit of correcting the underlying structural problem of the spine that could be relating to a bulging disc, causing bulging disc symptoms. But it all starts with a proper assessment and evaluation of the spine. So what is the anatomy of a bulging disc? And what are the symptoms of a bulging disc in your lower back? Let's get right into it right now. So a disc acts primarily as a shock absorber in the spine. There's a bone on top called the vertebra, a bone underneath called the vertebra, and in the middle is the disc. A disc is a strong fibrocartilage structure. Inside the disc is a jelly-like material. Now, when the spine is in its optimal alignment, its normal ideal alignment, ideally straight from the front, it has 3 natural curves from the side. The spine is actually designed and the discs are equipped to absorb the load and weight of the person's body on the individual discs and spine. However, when the spine is now shifted out of alignment and this misalignment becomes chronic. It's been there for years. There's now an uneven load distribution on those discs that accumulates over time and eventually causes damage to deteriorate those discs, causes degeneration of those discs, and they literally wear out over time. This can lead to tears in the disc called annular tears and eventually result in a disc bulge. Now, when the disc bulge becomes more severe or more advanced, it eventually will become a disc herniation, which means it's a more pronounced disc bulge. Now let's talk about the bulging disc symptom. A bulging disc itself is a pain generator in and of itself because of the inflammation that ensues or is produced due to that tissue injury. Inflammation often leads to a pain response, so definitely a disc bulge is a significant pain generator. So common symptoms would be the low back pain, very serious low back pain, gluteal or buttock pain, and even pain traveling into the thigh, into the back of the calf, and into the foot. Now, when a disc bulge begins to touch or irritate one of those delicate spinal nerves that come out from the side of the spine, the symptoms begin to become more progressive, such as radiating pain along the root of that nerve into the leg, numbness and tingling either into the thigh, calf, or even the side of the foot or the bottom of the foot. In some cases, when the nerve irritation is more pronounced or more severe, it can actually cause weakness in the muscles of the leg. And it's oftentimes that symptoms associated with a bulging disc can be so severe and so debilitating that it literally destroys someone's quality of life, not just from the pain perspective, but restricted mobility and not being able to do the things the person likes to do, whether it's at home or at work. Quality of life is significantly reduced when there's advanced serious symptoms and pain associated with bulging discs. This is why it's super important to get an accurate and precise assessment of the spine and spinal alignment, because abnormal spinal alignment can be one of the main causes that has triggered injury to a disc over time and eventually triggered that disc bulge or even caused that disc bulge over time. And once you've determined through the examination if there's a misalignment of the spine, that needs to be corrected. And chiropractic is one of the main types of healthcare that works on correcting spinal alignment, especially a form of chiropractic care called corrective chiropractic care, which is what we focus on in our office. And with these corrective chiropractic methods, once the spine alignment is improved, the postural position is improved, the actual uneven load distributions of the body on the spine is improved. That means there's less strain and insult on those damaged discs. That means that the inflammatory process can actually begin to subside and heal, overall resulting in a decrease in pain response, overall improving the person's functional mobility and quality of life. So if you've tried all sorts of therapies, perhaps even drugs or injections, maybe surgery, or have been consulted to consider surgery, consider a more conservative approach to handling or treating symptoms related to a bulging disc, such as corrective chiropractic care. Consider finding a corrective chiropractor near your town or in your town. And if you need help finding one, leave me a comment. I will do my best to help find one in your area. So if you like this video and you found it useful, let me know. Click on that thumbs up like button. Go ahead and share it with someone that may need this type of information. Of course, I want to hear your comments. If you tried any therapies already, was it a conservative method like chiropractic or physiotherapy, or was it a more mainstream medical method like drugs, injections, or surgery? Which one has worked for you? Which one hasn't? Let me know in the comments below. And be sure to subscribe to my channel so you don't miss out on fresh new videos that I release on a weekly basis. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.